All right, so we'll just cut to the chase on the exam. We've done inspection, seen him without his shirt on to get scars, incisions, things like that. So we'll start out in this position, palpate the AC joint for tenderness or pain. If it's tender, then sometimes I'll check for crepitus, popping, and do a cross-arm test coming across here with my thumb on the AC joint so that I can say, they can isolate and say, yeah, that's the spot. So after we do that, then I rotate out about 30 degrees, drop down here, and this is where we can palpate the biceps tendon. With it rotated out 30 degrees, we can feel it slip under my fingers right there. And so that'll be for biceps tendonitis as it's in the bicipital groove right there. Since we're already in this position, come up and we can do the Hawkins test, Neer's test, basically checking for bursitis, impingement, rotator cuff tendonitis right there. So those are very common things by palpation that we can get. I have patients go through range of motion, forward flexion, abduction with the palms up, and then I can check internal and external rotation. For me, the most functional is thumbs on the middle of the spine and see the difference in their range of motion. At any point during that, if they have it where it's asymmetric, they can tell me where the pain starts, and then I check passively to see if it's any better. If it's not, then throw the diagnosis of frozen shoulder on there and we have to evaluate how they got frozen shoulder. To isolate the rotator cuff muscles the best, thumbs down, about 30 degrees forward. While I'm explaining to him, I let go of his hands so I can check for a drop arm test to see if it's a big rotator cuff tear. Then I tell them to resist, don't let me pull their arms down. So that's checking supraspinatus. Arms in here, checking for external rotation. The easiest way for the patient to understand and isolate is to say, don't let me push your hands together. So when I push together and they resist, that's our external rotation. If you tell them to rotate out like that, they normally abduct and you're not isolating the infraspinatus, so it's the rotation. The quickest way while they're sitting here to check the subscapularis in the front is don't let me pull my arms off here. That's a quick way to do it. The actual way to test it is to put palm on your back and to have them push off, but it's hard for patients to understand that. Sometimes it's hard for them to get their arm back behind them and it's painful. So this is a quick test, and if I sense any problems there, then I can always go ahead and check it the normal way. Just a quick, easy, dirty way to check it.
Thanks.